I'm Philip Debruyne. I'm a medical oncologist based in Kortrijk in Belgium. About 10 years ago, I was doing research around the subject of the relationship between distress and cancer-related cognitive impairment, or chemo-brain. At that time, we discovered that subjective cancer-related cognitive impairment was related to the levels of distress in cancer patients and cancer survivors, and that this was associated with lower levels of quality of life. Simultaneously, I was an honorary senior fellow with the Center for Positive Aging at the University of Greenwich in London. At that time, our director, Professor Pat Schofield, was pioneering research around the involvement of public in clinical research. And she had a pain advisory board where lay members of the public and patients could give their advice around research. When I arrived at the University of Greenwich on a bank holiday in 2014, I found the university to be closed. However, I was able to link with the lay member in my research cluster, Kathleen Merrick, when we went for a cup of coffee in the shadows of St. Paul's Cathedral. At that time, Kathleen introduced me with emotional freedom techniques. I've never heard of that technique, that complementary medicine technique at that time, and she explained to me that it was helpful for a lot of symptoms and that it was a very efficient technique to reduce the levels of distress. Together we concluded that it could be very interesting to test the effects of emotional freedom techniques on cancer survivors presenting with the chemo-brain. With colleagues from the Belgian Medical Oncology Society task force dedicated to survivorship, we designed a clinical trial where we compared emotional freedom techniques with a waitlist control to see if emotional freedom techniques were effective to treat the chemo-brain. And to our surprise, I must admit, we found that emotional freedom techniques, or EFT, were a highly efficacious self-help tool to treat the chemo-brain. It was also associated with lower levels of emotional symptoms of fatigue and, very importantly, quality of life. I hope that you will join me on my keynote lecture in the coming International Symposium of EFT International, and I will explain you further our very interesting story. Hope to see you there.